One of the three key elements for patient empowerment is self-awareness. Is the ability to pinpoint the source of your unease or anxiety when you go to seek care in a healthcare environment. This is really important to talk about because for a lot of patients, it can be so overwhelming that it prevents people from seeking care in the first place. Unfortunately, this is especially true for communities that have experienced historical marginalization. So some patients have experienced racism, sexism, ableism, homophobia, you name it. And so for those communities or people who are from those communities, visiting the doctor isn't just stressful, it can even be traumatic. My name is Dr. O. I'm a family physician, public health specialist, and medical educator. In this video, we're going to jump into the first component of patient empowerment, which is self-awareness. So, how do you address these feelings of unease? How do you pinpoint the source of your anxiety when you go and seek healthcare? Identifying the underlying cause is key. Even for me, before becoming a doctor, I had experiences of less than ideal care. We all have. When you reflect on your negative experiences, think to yourself, how did it make you feel? How did you react in the moment? What did you need? And how could things have been done better? So this may not be easy. When you're thinking about the negative experiences, you might experience some discomfort or uncomfortable feelings. Have some grace for yourself. It's a process. But if you're experiencing a lot of distress when you remember those negative moments, or you are experiencing a lot of anxiety, or you had a traumatic event in healthcare, then I would suggest actually unpacking that with a professional or seeking additional help just to help you move through that and not doing it on your own. But if you're okay to kind of reflect on those negative experiences, then I do encourage you to do so, because that takes you to the next step, which is thinking about how you would have liked your healthcare journey to have been in a more positive light. What could have been done differently? How could your treatment have been better? And how could you have reacted differently? Try to reflect on what you want your future to look like, mind, body, and soul, with regards to your health, and think about what that positive healthcare experience would feel like. And remember, this is a process. It's about progress, not perfection. Once you have a sense of what went wrong and how you would like things to go, if it's going right and in a way that feels good to you, then you want to think about the kind of provider or clinic where you want to seek care. Now, I know right now finding a provider can be challenging, but generally speaking, I would say that clinics that focus on specific populations like women's health, men's health, indigenous communities, Black community health, or immigrant health, also to us LGBTQ health, those types of specialized clinics usually have an approach where they can be trauma-informed and it's just more patient-centered. And so, granted, sometimes those can be difficult to find, but there's a lot of community health centers that are geared towards that kind of comprehensive care. And so I put a list in the description so you can find out if there's a community health center in your community. Overall, community health centers take a very patient-centered approach, and so they really make it less likely that you'd be in a situation where you feel unheard or unseen. Some hospitals and clinics have a patient advocate. So that's somebody who's a professional who can help you navigate through the system and make sure that you don't feel isolated within that hospital or clinical setting. If you're not sure if your clinic or hospital has a patient advocate service, one option is to just call and ask, or you can check their website to find out what support is available to you. So once you've done the work to pinpoint the source of your unease or anxiety in healthcare and decide, okay, what would it look like if you're getting the kind of dignified care that you want, then another option is ask a friend. So that might be family or friends or people you know. Ask where they seek care, and if they've got a really care provider that provides patient-centered care, then they might actually give you a really good recommendation. The other option is actually to think about groups that you belong to or community organizations, and they actually also might be able to provide some advice on where you can get culturally safe care or care that meets your language, culture, or other needs. So that is the first step to patient empowerment, identifying the source of unease so you can overcome it. That is self-awareness. Once you understand where the sources of unease are coming from, then you can take the necessary steps to feel more comfortable and confident on your healthcare journey. In the next video, we're going to dive into self-advocacy, what to say and do in the medical space to get what you need. Thank you for watching, and please subscribe to stay on top of all things healthcaring differently. And remember, you got this.